Now, if you're someone that has recently had a surgery, then you probably have dealt with swelling that has been uncomfortable, has caused increased pain, and even joint stiffness and tightness. And after reading tons of articles and watching videos, you probably have learned that the only way to get rid of this swelling is by using the typical method of RICE, which is rest, ice, compression, and elevation. And although these methods are effective, they don't necessarily work for everybody. Some people just have a harder time getting rid of the swelling. And in this video, I'm going to share with you 7 effective ways that can help you get rid of swelling after surgery. And make sure to watch all the way through because there are going to be some important tips of each of these methods that you're probably missing now. Let's get started. What's going on, guys? It's Dr. Mike and I'm a physical therapist providing tips on how to build strength and longevity with your body. Today, we're going to be talking about some of the most effective techniques that you can use to help get rid of your swelling. So whether you had a recent surgery or whether you had a recent injury, these are some easy techniques that you can use to help get rid of that swelling and improve the healing time in your recovery. Now, the first method that we're going to talk about that you often probably have already read about is the use of ice. Now, ice is a modality that we commonly see in the physical therapy profession to help calm down any inflammation and help reduce swelling. Now, you want to generally use this for an acute surgery or acute injury. And then as you start to recover and get better, you're obviously wanting to move away from the ice and maybe even consider some heat. But in the sense you're using an ice pack or maybe even some frozen vegetables out of your fridge, you're taking it out and you're applying it specifically where you're dealing with the most of the swelling there. Now, this can be anywhere between 20 to 30 minutes at a time. And sometimes for people, that's 4 to 5 times a day. Now, everyone handles swelling a little bit differently. So some people may have to ice more and some people may have to ice less. Now, the important concept to understand here is that when you're applying the ice over the skin, you want to make sure that there is a thin barrier between the ice pack and your skin to make sure that you're protecting your skin. But also you want to make sure that the ice is nice and firm along the skin so that you can actually feel the ice. One of the mistakes I see a lot from my patients when they're using ice over a knee replacement or a hip replacement is the ice is just not cold enough, or maybe the layers in between the ice and their skin is just too thick, so they're not feeling a lot of cold along the skin. In order for this to be effective, to really minimize the swelling in the joint or wherever you had the surgery or the injury, is you want to make sure that you feel the cold as the ice pack is laying over the affected area. The second way that can effectively help you get rid of swelling is by elevating the limb or your body. Now, for instance, if you're dealing with a knee replacement or a knee surgery, then that simply means that you would elevate your leg above heart level. And typically some patients will come home with a wedge, and this wedge will allow them to get their leg high enough above their heart when they're laying down. If you've had a surgery maybe on the shoulder or even on the elbow, this requires you to get your arm a little bit higher above your heart. You might consider using pillows or some support to really help you get that arm elevated. Now, if you've had a procedure along the abdominal or even the lower back area, in order to maximize the effectiveness of elevation, instead of lying down, you might actually benefit from sitting up more often. So with use of elevation, you want to make sure you're doing this for 2 to 3 hours at a time, and then monitoring what's happening with the skin to seeing if the elevation is actually making a difference with the swelling that's happening. Now, the third way that we're going to talk about to help minimize that swelling is reducing overactivity. Now, we're going to talk about a little bit later how movement can help improve the swelling and help get rid of the swelling that's in that injured or surgery part. But one of the most important concepts that you have to consider is reducing overactivity. This is when you're being on your feet or using your arm too much after the surgery or after the injury, and this will cause an inflammatory process and cause a lot of the swelling to kind of go back to the area to help improve the healing time. That swelling is a sign to your body that's telling you that you're healing and you might be doing too much too early and could be affecting the healing time and the recovery of your surgery. So make sure that we're not doing too much and you're really monitoring each day whether the activity you're performing is either helping your recovery or delaying your recovery. And one simple way that you can know this is whatever activity that you're performing, after 24 to 48 hours, if you're noticing that the swelling is worse after that activity, then that is a good indicator that is probably making your condition worse. For instance, a lot of my patients that have had knee replacements, one of the questions that I get a lot is, can I be walking, or how much is too much walking? One of the best ways that we can help determine how much walking they can be doing is by having them monitor how much swelling that they have after they're walking. So if they're walking for 10 to 15 minutes and their joint after 24 to 48 hours is not extremely swollen, then that typically means that your body is tolerating that amount of activity appropriately. Now, on the other hand, if you're walking for 15 to 20 minutes and after 5 minutes your joint gets very swollen, then that also tells you that you're probably not ready to start increasing the walking and your body needs a longer time with the healing process. Now, the next way that you can help minimize the swelling is with use of compression. Now, many of my patients will come home with some ACE bandages, and that is a great way that you can wrap the limb and help create some compression along the joint, whether that's on the shoulder, elbow, or even on the knee or on the hip. So you're gonna simply wrap that around, not so much where you're gonna have numbness or tingling, because you definitely don't want that occurring, but you definitely wanna wrap it firm enough so that you can feel some compression, which will help push some of that swelling outside of the joint and push it throughout the whole body. Now make sure if you are gonna use this, that you check with your surgeon or you check with your healthcare provider, because in some scenarios, compression might not be beneficial for you, and your primary care provider may not want you using it at this time. Now, the next method that can be highly effective in helping you get rid of the swelling and often is overlooked is the use of gentle massage and effleurage. Now, this is a manual technique that you can use by simply using both hands and clasping them together along the swollen joint. And you're gonna basically apply some firm pressure and you're moving the swelling up and down in these long longitudinal strokes. And what you're trying to do is basically push the swelling out of the joint and move it up throughout the rest of the body. So if you're focusing on a knee surgery, then you would simply start at the ankle and work your way up the ankle to the shin, past the knee, and all the way up to the upper thigh. And you'd simply work on that upward motion to help push that swelling up throughout the rest of the body. And you can perform this from 2 to 3 minutes at a time. And you could do that a couple times a day. That can really make a difference with your swelling. Now, the next method that can help you get rid of the swelling, which I'm a firm believer on, is the use of Kinesio Tape. Now, many people believe that this might not be as effective as they think, but this is a tool that we can use that is cost effective and can be simply applied and be used for 4 to 6 days at a time. And you would simply use this adhesive tape that stretches and allows for greater movement. And you would apply it over the skin that has the most swelling. Sometimes that's over the joint, sometimes that's surrounding around the joint. And you can cut some strands or either use long strips to apply this over the area that is swollen. Now, the nice thing is you can use this tape right after surgery and it stays on for about 4 to 6 days. Now, if you want more information on what Kinesio Tape is and just how to apply it, take a look at the video I made up here. Now, the last method that we can use that can help get rid of the swelling is simply movement. Now, this can be done by moving a joint or moving the body part around where you had the surgery to help kind of promote blood flow and circulation and help get rid of the swelling along that localized area. So for instance, if we're talking about a knee replacement, this is why ankle pumps can be greatly effective, because it is moving the joint that is distally from the knee, which means further away from the knee, and using a pumping mechanism to help improve the circulation and use all those muscles to pump that swelling out. Or maybe you're even dealing with a surgery to the upper body, like the shoulder or the elbow. I've even had a lot of my patients maybe jump on a recumbent bike because now they can use their lower body and all their leg muscles to help pull some of that swelling out of the arm and get distributed throughout the rest of the body. So the important point I want you to understand here is that when you've had a surgery or when you've had an injury, we want to continue to move the joints, especially around that area, to help improve the swelling and get things moving in the right direction. Versus if you just kept your joint in one static position and you never moved it, you are more likely going to get stiff and immobile, and all of the swelling is going to want to collect in one area. So motion is lotion, and continue to move the joints around your body. Now, those are some of the most effective ways to help you get rid of your swelling after a recent surgery or an injury. Now, if you found value in this video, please support me by giving this video a like and a thumbs up. And if you want more information on how to build strength and longevity with your body, please consider subscribing and hit that notification buttons so you stay up to date with all upcoming videos. I'll see you in the next one.